With Oracle EPM Planning, you can perform flexible and data-driven planning and forecasting required by your healthcare organization. The Oracle Healthcare Planning Solution is a highly configurable implementation accelerator developed on top of Oracle EPM Planning Financials, providing best practices for healthcare to help facilitate your planning process. The role-based navigation flows were designed with the end user in mind and follows best practices for a standard healthcare operational planning and forecasting flow. Provider finance includes all tasks in Nurse Manager and Department Manager. The vertical tabs on the left represent a process flow for your budgeting process. Each main section opens an overview dashboard that allows you to view and analyze data at a higher level. The out-of-the-box visuals are based on KPIs and can be tailored to your organization's needs. By setting global assumptions, budget administrators can quickly establish a budgeting baseline that can be copied across departments, service lines, or facilities. Once you set global assumptions, you can run a calculation that creates a touchless budget with an initial projection, year forecast, and a budget for the next year. Review volume-based assumptions that will drive the revenue and variable labor and expenses throughout the model. You can choose to derive volume at the entity level or service line level. Select which level your organization will use when you implement the solution. For example, if you choose to derive volume from the service line level, you won't need to use the entity level. Each plan includes horizontal tabs that help you complete the volume planning process, starting with an overview dashboard that lets you review volumes and revenue components, as well as visualizations that help you quickly understand how the organization is performing by various service lines. Set inpatient and outpatient volume-based assumptions by service line. In this example for cardiology, I can set a forecast method assumption for this sub-service line. The selected forecast methodology can leverage data from either historical data or the budget to calculate the projection. You can adjust the projection based on a percentage or a fixed value. That calculates and sets the projection for the current year. The next step is to create a projected budget for the next year. Likewise, you can adjust the projected budget based on a percentage or fixed value, and that will establish the budget. The same steps can be repeated on the rest of the volume assumptions, such as inpatient payer mix, average length of stay, and so on. Here you can review the final calculated days by payer. With outpatient volumes per service line, instead of planning per case or discharge, you can plan for each account, such as outpatient visits, emergency room visits, and outpatient observations. After you have your volumes by service line and payer, you can add your revenue rates to determine the gross and net revenue. Here's your revenue or reimbursement dashboard. You have your gross revenue, total contractuals, which are deductions from the gross revenue, and the difference between those two is what you are reimbursed for your payers. First, set your reimbursement methodology for inpatient and outpatient payers. Assign a reimbursement method for each payer. For inpatient payer reimbursement, you can choose from 4 out-of-the-box calculation methodologies: per case, per diem, percent of charge, and case rate. View the calculations in the reimbursement model tabs for inpatient and outpatient. You have your payer and service line in the POV. Here's the gross revenue calculated based on the inpatient revenue per patient day. The total inpatient reimbursement is then calculated from either a reimbursement rate per patient day, by discharge, or a percentage based on the methodology selected. You go through a similar process for outpatient reimbursements. You can also plan for bad debts and charity care by payer or in total on these tabs. Planning for other revenue follows similar methodologies. You start with the overview dashboard and then enter assumptions and calculate projections and budget in the next tabs. Related videos are listed in the description. To learn more, visit docs.oracle.com.